Ever wondered what the wisdom teeth removal procedure is like? Well, let's get into it. Wisdom teeth removal is often necessary when there's not enough room in your mouth for them, or they're causing discomfort or health problems. It's a procedure that can be performed in various settings, such as a dentist's clinic or a surgeon's office, and it usually involves 5 key steps. First, there's sedation or anesthesia to ensure your comfort throughout the procedure. Then comes the incision, which is necessary if your tooth hasn't fully erupted or is trapped by the bone. This is followed by the dissection of the tooth if it's in an unusual position. After that, we move to the extraction stage, where the tooth is carefully removed. Lastly, the gum is stitched back together to facilitate healing. This procedure, although sounding complex, is quite straightforward when broken down into these 5 steps. Let's dive deeper into each one in the upcoming video. The first step in the process is sedation or anesthesia. This is an essential part of the wisdom tooth removal procedure, designed to ensure patient comfort and ease. It's not just about numbing the pain, but also about relieving anxiety, making the process as stress-free as possible. Sedation or anesthesia is administered by a trained professional who carefully monitors the patient's vitals to maintain safety throughout the procedure. It's particularly recommended for longer or more complex surgeries. Imagine this. You're sitting in the dentist's chair, knowing you're in for a lengthy session. The last thing you want is to be fully aware and anxious about every little movement. That's where sedation or anesthesia comes in, providing a buffer between you and the procedure, allowing you to relax. For those who are particularly nervous, sedation can be a game changer, turning a daunting procedure into a manageable one. With the help of sedation or anesthesia, the patient is prepared for the next stages of the procedure. The second step involves making an incision. Now, this might sound a little daunting, but it's a necessary part of the process if your wisdom tooth hasn't fully erupted. What exactly happens during this step? Well, your dental professional will make a small cut in your gum. This incision serves to expose the wisdom tooth, making it accessible for extraction. If your wisdom tooth is playing hide and seek, trapped within the jawbone, an extra step might be necessary. In such circumstances, a small part of your jawbone may need to be carefully carved out. This isn't as scary as it sounds. It simply provides a clear path to reach and remove the wisdom tooth effectively. Remember, this incision is not just about slicing and dicing. It's a meticulously planned and executed procedure that ensures your wisdom tooth is ready for its final curtain call. The incision is a crucial step that prepares the tooth for extraction. The third step is tooth dissection. Now, let's say your wisdom tooth has decided to be a bit rebellious and isn't sitting quite right. Instead of playing nice and growing in the usual position, it's taken a detour. In such cases, your dentist will need to intervene with a bit of creative problem solving. Instead of trying to wrestle the whole tooth out in one go, they'll break it down into smaller, more manageable parts. This is what we refer to as tooth dissection. It's a bit like breaking down a large piece of furniture so it can fit through a narrow doorway. By reducing the tooth into smaller pieces, we also reduce the size of the hole in the gum that's needed for extraction. This can help to minimize trauma to the surrounding tissue and make the healing process smoother. Tooth dissection simplifies the extraction process, making it easier to remove the tooth. The fourth step is the actual extraction. This is the moment of truth when the problematic wisdom tooth finally gets removed. After the necessary preparations, the tooth is ready to say its goodbyes. The extraction process is quite straightforward. The dentist or oral surgeon will carefully rock the tooth back and forth within its socket. This is done with the utmost precision and skill to ensure a smooth extraction. Now, you might be wondering, will I feel anything during this process? Well, you might experience a sensation of pressure. This is completely normal and is not a cause for alarm. It's just the tooth being persuaded to leave its cozy nook. This pressure is part of the process, and it's a sign that the tooth is on its way out. With the extraction complete, the patient is almost through the procedure. Just one more step to go, and it's a wrap. The final step is stitching. Now, after the extraction of the wisdom tooth, the area is left with a hole. This is where the magic of stitching comes into play. Your dentist will quickly and expertly sew the site back together. This is done to prevent excessive bleeding and to aid in the healing process. The stitches used are usually self-dissolving, which means they will disappear on their own after a few days. Isn't that neat? Now, you might be wondering, does this stitching process hurt? The answer is no. Thanks to the anesthesia or sedation you received at the beginning of the procedure, you'll be comfortably numb during the stitching. You'll probably feel a slight tug or pull, but no real pain. Once the stitching is done, your dentist will not leave you empty-handed. They will give you something that looks quite ordinary, but is incredibly important: a gauze pad. This small piece of material plays a significant role in the immediate post-procedure care. You will need to press this pad onto the extraction site. The pressure helps form a blood clot, which is essential in the healing process. It also helps manage any swelling that might occur. Now, don't be alarmed if you notice some light bleeding after the procedure. This is perfectly normal and expected. The gauze pad will help absorb this. Remember to replace the gauze pad as directed by your dentist. Stitching is a crucial part of the wisdom teeth removal procedure. It ensures the extraction site is sealed properly, helping to kickstart the healing process. It's a testament to the skill and precision of your dentist, ensuring that even after the tooth is long gone, the site is left clean and well protected. With the stitching in place, the wisdom teeth removal procedure is complete. You've bravely navigated through this journey, and now it's time for recovery and healing. Remember, follow your dentist's aftercare instructions carefully, and before you know it, you'll be back to your normal self, minus a few wisdom teeth.